Today we're going to talk about protecting the aging brain and a revolutionary understanding of brain decline and effective strategies to recover your brain health. My name is Dr. Michael Veselak. I'm a board certified in integrative medicine and a certified functional medicine practitioner. What will be covered in this lecture is a basic understanding of how the brain works, some underlying causes of brain decline, what can be done to maximize your brain's health through integrative medicine and functional neurology, and how to perform a neurological self-evaluation. So some fundamental steps that I want to talk about before we get started is I want you to think about and compare your brain status and peak performance. Like, at what age did you really feel your best? And has there been a decline in memory, balance, or focus? Are you now sensitive to sound, light, or do you have ringing in your ears? Does function fluctuate during the day? Is it hereditary? Dementia, Alzheimer's, Parkinson's? Has exercise or a supplement made a noticeable difference, either positive and or negative? Have you noticed brain fatigue in attention span, reading, driving, or working? It's important because we lose endurance prior to function. Brain disease is costly. This is an advanced picture of Alzheimer's in an advanced stage, and you can see on the right the destruction compared to the healthy brain on the left. This picture here is a SPECT scan 8 years before the onset of cognitive decline, so you can see how much deterioration actually happened. So part of the issue today is we want you to get an understanding so we can hopefully detect early changes before it's actually too late. So right now, Alzheimer's disease is the most expensive condition in the nation. In 2014, the cost to American society was $214 billion. And it's estimated that in the year 2050, the cost will be $1.2 trillion. Here are some symptoms of functional soft brain lesions. And by soft, I don't mean tumor. Basically things like depression, anxiety, insomnia, fatigue, memory loss, brain fog, attention deficit, inability to focus, not enjoying life, not being social, being too emotional, impulsive, sometimes vertigo or blurred vision, weakness, numbness, or tingling, difficulty following directions, OCD, high blood pressure, mood swings. So soft brain lesions are extremely prevalent. 1 out of 8 seniors develop Alzheimer's. 1 out of 8 children develop a spectrum disorder such as autism or ADHD. Dementia, 24 million in the world, which is to double by the year 2040. There's an increased use in antidepressant, anti-anxiety medication. And the number 1 cause of accidental death is falls. And there's tremendous issues with balance disorders, especially in the seniors. So our goal tonight, as I stated, is early detection. We're going to go over a few basic concepts because I definitely feel you need to understand the basics before we progress. So neuroplasticity is where the neurons actually connect together. It is about how they connect, not how many we have. Neurodegeneration, this is the need to identify people at the early stages to positively impact the outcomes. So as an example of neurodegenerative condition is Alzheimer's, Parkinson's. As a brain degenerates, it will lose the ability to perceive the loss of brain function and the motivation to improve. So the takeaway point is everyone has the ability to reconnect neurons. We've heard, the right brain is more the creative brain, the left brain is the analytical, logical brain. And during life, we're basically born with kind of a dominance towards one side or the other. We're either really creative, a little analytical. Some people are extremely, equal on both, but it's rare. Most people are kind of the opposite. So if you are a person that was born more left brain, analytical, logical, it basically means your right brain has a predisposition to degenerate at a faster rate. So I would say it's important to start doing tasks that build up this part, like art and creative tasks. And then on the other side, if the left brain is degenerated, you want to be doing math skills and word comprehension and Sudoku. So a few more basics. All neurons have electrical activity, which we call the resting potential. And when it's stimulated, it spikes to fire the neuron to its threshold. So a degenerative neuron is actually closer to that threshold. It takes less stimulation to activate it. So it's why a patient, as they get older, they start to get ringing in their ears, tinnitus, or little tremors, sensitivity to light and sound, and maybe increased or heightened pain. It doesn't take a lot of stimulation to activate these neurons, and yet so they're a little bit more responsive. This in turn affects the mitochondria of the cell, and it creates more oxidative stress, and in turn we begin to lose endurance and less energy, causing a loss of function. So if you eat MSG, or if you notice when you eat certain glutamates or diet sodas and you get this excitatory reaction or some reaction, it means the neurons there are a little closer to threshold. You're a little bit more sensitive. So what does a healthy brain need? Well, basically it needs a few things. It needs fuel, which is the form of oxygen and glucose. It needs activation. It needs proper neurotransmitters, and it basically needs an inflammation-free environment. So, and if you don't have these basics, medication will not work long term. Another concept is metabolism. We hear that word a lot, so what does it really mean? It means when we eat food, our proteins, our carbohydrates, our fats, it's supposed to convert it to energy. And if we have a metabolic problem or we have difficulty converting it to energy, we're going to have decreased energy production, and this in turn will lead to metabolic issues. So do you know which organ consumes the most energy by far? It's the brain. Up to 30% of our glucose and oxygen is consumed by the brain. So if you have blood sugar issues or anemia issues, circulation issues, the brain is going to have, some degenerative changes through time. So on our website, MTHFR and more, and drmichaelveselak.com, we have a brain assessment form that if you would like, you can fill this out. And basically what it does is evaluates brain endurance, possible early Parkinson's, dementia, and it is not diagnostic by itself. So it's basically a guideline. And if you see you have a lot of, threes throughout the page, I would say you should probably be addressed by a neurologist. It also evaluates different lobes of the brain, so it gives us a nice little insight to what you think your function is at this point in time. So here are the brain regions. The yellow, that's the frontal lobe. The blue is the parietal lobe. The green is the occipital lobe. The red is the temporal lobe. The orange in the back is the cerebellum. And then we have the brainstem coming off of the temporal lobe adjacent to the cerebellum. I'm going to talk about the different areas of the brain and what functions they have, because if we're starting to have difficulties in some of these areas, we might want to address the frontal lobe or the temporal lobe and what the importance of each of these are. So the frontal lobe is the largest lobe, so it needs a lot of energy. It defines our personality, executive decisions, social behavior, impulsive control, our focus, and motivation. Also, our voluntary muscle movement occurs in the frontal lobe. So if you have depression, there's a lot of dopamine in the frontal lobe. It could be due to frontal lobe fatigue. So some symptoms of frontal lobe degeneration are depression, anxiety, slow movement, mental sluggishness, poor impulse control, like saying things that you just don't have the filter like you used to have, getting mad or angry too fast, poor focus, poor handwriting. So if you notice there's been a decrease in your handwriting recently, then that could be an issue. And then poor cognitive learning with regards to math and language. These are all symptoms of frontal lobe degeneration. The temporal lobe is really responsible for hearing, speech, memory, smell. So the hippocampus is located in the temporal lobe, and this is the area of the brain that degenerates with Alzheimer's. It will also control our circadian rhythm, which is our sleep-wake cycles, and short-term memory. So, symptoms of temporal lobe degeneration are memory loss, hearing difficulties, sometimes the ringing in your ears called tinnitus, insomnia, abnormal shifts of fatigue during the day, and dementia. The parietal lobe is responsible for all touch sensations, hot, cold, and pain. It interprets input from different parts of the body, the skin, the muscles, joints, so that our body actually knows where it is in space in relationship to its environment. There's a part of the brain, you see the little two strips there, one orange and one red. So the orange one, it's called the homunculus. They've mapped out throughout this whole strip in the parietal lobe that certain parts of that somatosensory strip correlate to the feet, the back, the eyes, the face. And of the motor strip, it controls the motor activity. So if you have had an injury to, let's say, the somatosensory strip or the motor strip, it could affect different parts of the body when actually the area of injury was to the brain. So when we evaluate somebody, we always evaluate the homunculus to try to see if there's a correlation to any brain-related injury or degeneration that's affecting the symptoms somewhere else in the body. Some symptoms of parietal lobe degeneration are misjudging where your body is, so you're always spraining your ankle or bumping into objects, and it could be getting lost easily, inability to follow directions, numbness, tingling, or hypersensitive to certain parts of the body, usually on the same side. The occipital lobe is responsible for processing visual information, shapes, colors, movement. So sometimes if we're getting visual floaters, this could be a degeneration of that. Some people have visual hallucinations. This can also be a little degeneration. So, and then probably the most studied or area of the brain that I focus on is the cerebellum. It's called the little brain. This calibrates all muscle coordination. It calibrates input from the inner ear for balance and eye movements. It calibrates information of the muscles, joints, and filters it before it sends it to the brain. So it controls balance, posture, and motor coordination. So if the cerebellum is degenerating, these things can occur. You can have dizziness, vertigo, blurred vision, nausea from visual inputs. So if somebody does, if you see, let's say, a polka dotted shirt or a striped shirt, you get a little nauseous, that could be an issue with the cerebellum. Poor balance, sometimes a subtle tremor at the end of a movement. So you'll reach for something at the end, you just get a slight tremor of your hand. And chronic neck and back problems can be a sign of cerebellar degeneration. Now the brainstem, this controls the autonomic nervous system. That's the things that we control automatically. Our glands, our blood vessels, respiration, heart rate, our organs. And there are two parts of the autonomic nervous system. There is the sympathetic, which is our fight or flight. That's in the upper part of the brainstem called the mesencephalon. And there's another part called the parasympathetics, which is our rest and digest, primarily from the vagus nerve, which is in the lower brainstem. Now, guess which system fires when we are stressed? That's correct. The sympathetics. So, and stress is not only emotional, but it can be chemical. So if we're exposed to different toxins over a period of time, it can be a problem, like heavy metals. It could be metabolic. You could have glucose, like diabetes or anemia, over a long period of time that could put your body into a state of stress. So normally, the parasympathetic should be in control most of the time, and our body should be inhibiting or breaking the sympathetics. But sometimes we get this sympathetic escape, and it creates all these other symptoms. So 90% of the neocortex job is to stimulate the parasympathetic activity, 10% for the sympathetic activity. It's only really supposed to be used in true fight or flight. But these days, we're all under so much stress that a lot of my patients just are in constant sympathetic overload all the time. So we evaluate the different lobes of the brain that are inhibitors to the mesencephalon or the brainstem to make sure that the fight or flight mechanism is in check. Here are some symptoms of some high sympathetic activity. You can have high blood pressure, dry eyes, dry mouth, poor digestion or constipation, headaches, chronic pain, insomnia, fatigue, sensitivity to light or sound, cold hands or feet, frequent urination or incontinence, erectile dysfunction, and low libido. So let's talk about what really causes the brain to degenerate. Well, there are a lot of things. It's just not one thing. You always have to address the fuel delivery system. So are there blood sugar imbalances? Is there good circulation and oxygen? Are you under too much stress? Are there food sensitivities? Is there poor gut function, motility, digestion, constipation? Is your body in a constant state of inflammation? Is there proper neurotransmitters or hormonal imbalances? Do we have a good essential fatty acid ratio, the 3s, the 6s, the 9s? Are we constantly exposed to toxins, or is it just plain lack of activity where we just get no exercise, we sit in our chair and watch TV all day long, and we're not stimulating the brain? So let's talk about these imbalances for a bit. So first of all, blood sugar imbalances. It could be insulin resistance, which for me is any blood sugar fasting from over 100, or diabetes, which for me is anybody over fasting blood sugar of 115. It could be hypoglycemia. Now I'm going to be talking about functional reactive hypoglycemia, which is below 85. So low blood glucose could be as significant as high blood glucose. So if you know that if you don't eat your meals and you start getting shaky and spaced out, that could be a sign of hypoglycemia. The numbers I just kind of talked about. So my functional medicine values are 100 to 115. So some of the causes of insulin resistance is so prevalent in our society is we could wait too long between meals, so this huge insulin surge. But really, in our society, we just eat too many carbs and we consume too much sugar. So the average American consumes 150 to 170 pounds of sugar a year. I mean, think about that. That's a quarter to a half a pound per day. And then we just don't exercise enough. And then we have high stress, which releases cortisol, which increases insulin resistance. So here are some of the symptoms of insulin resistance. If you eat a meal, you get tired right afterwards, that's a sign. If you crave sweet right after a meal, that could be a sign. Difficulty losing weight, frequent urination, aches and pains that just don't move, and increased appetite and thirst. Another real important part that can affect the degeneration of the brain is stress. And we are all under a ton of it these days. So stress does atrophy the brain. It will cause a degeneration. It promotes brain inflammation, and it breaks down the blood-brain barrier, which is supposed to be non-penetrable, so impermeable. And so these are major. That allows the toxins to enter the brain, which can create major inflammation of the immune cells or the glial cells. So cortisol, which is the stress hormone, if we have too much of it, it will accelerate the degeneration of the hippocampus. As I stated earlier, the hippocampus is located in the temporal lobe, and its responsibility is short-term memory. So if you're getting degeneration, you're going to have memory loss and or dementia. It will also affect the pituitary gland, which is our master gland, which will affect thyroid function and in turn make it difficult for you to lose weight or possibly even gain weight. Circulation and oxygen. So again, we need the fuel in the form of glucose and oxygen. The brain consumes 30% of the oxygen intake in our body. So if we can't produce enough energy with oxygen, our neurons are going to suffer. And as we all know, if the brain's deprived of oxygen for a period of time, usually greater than 5 minutes, permanent damage will result. So we need to make sure we're not anemic and that we have good circulation to the brain. So some of the symptoms of poor blood flow to the brain is low brain endurance, which means poor focus and concentration. So if you're reading a book and you have to keep reading that page over and over, that could be a sign of low brain endurance. If you need coffee to improve brain function and you have to exercise just to stimulate it, that could be a sign of poor brain function. Cold hands and feet. Poor nail or fungal growth on the toes is a sign of poor blood flow. Some people have to wear socks at night because their feet are so cold. And the nail beds, instead of being pink, they're just white. So, and the tip of the nose will be cold. So it's these are all signs of poor circulation and poor blood flow to the brain. So some of the causes could be stress. So if you're under fight or flight, you become we call it a shallow breather. You're not going to take a deep breath in to fill your lungs with the oxygen that it needs. Anemia surely will cause it. Smoking, low or high blood pressure, poor cardiovascular function, and diabetes all are causes of poor circulation to the brain. So poor gut function basically equals poor brain function. There's a brain-gut axis. And on the opposite, poor brain function will cause poor gut function. So it goes both ways. The gut needs to be healthy, the brain needs to be healthy. The vagus nerve, which comes, it's the 10th cranial nerve, which comes from the brainstem, stimulates the motility, the digestion, and that's our rest and digest nerve. So the gut must be addressed, and we need to look at food sensitivities. So the common ones are gluten, dairy, soy, sugar, alcohol. And if you're not sure, get tested. Cyrix has a great lab that will test these things for you, and it's very reliable. So other cause of poor gut function is poor diet, high stress like we talked about. The food sensitivities. It could be more than the 5 that I just mentioned. You can have something called leaky gut syndrome where the lining of your gut mucosas become thinned out, more permeable, allowing these other molecules to start to circulate your bloodstream, creating an inflammatory and sometimes an immune response. You can have dysbiosis, which is basically bacterial issues or bacterial overgrowth, SIBO being one of those. And then gut infections from parasites and fungus. So body or gut inflammation can lead to brain inflammation, and brain inflammation can lead to body or gut inflammation. It's really important that you know it can work both ways. So when we address a patient, we are a functional medicine practitioner. We look at the whole body, address the brain as well as the gut to optimize health for that patient. So other causes of brain inflammation is high homocysteine. Sometimes people have the genetic predisposition for it. That's why we like to run the 23andMe data to look at the overall genetics. But it's a lab marker that if it's too high, it will cause destruction of not only nerve, but cardiovascular tissue. And alcohol also affects the cerebellum. So if you notice you're super sensitive to alcohol, that when you drink just a little bit, you get a little bit off balance and in a brain fog, I would say don't drink it. You're putting too much pressure on that cerebellum, and there are different antibodies that can occur where you can actually develop an autoimmunity, a GAD antibody to the cerebellum, which is not a good thing. So 90% of the brain cells are immune cells. They're called microglial cells. Now, when I was in school and we dissected a brain, we looked at all this mass within the brain, and we knew what they were called, we just didn't know what they did. So 90% of them are immune cells. And then we need to address neurotransmitters. There's some key ones. You have acetylcholine, which is for memory, comprehension, and math. Serotonin, which is enjoyment, satisfaction, and sleep. Dopamine is motivation, being social, and self-worth. And GABA is our only inhibitory neurotransmitter. It's calming, and it's an anti-anxiety, worry neurotransmitter. The key is, though, proper balance. When we look at neurotransmitters, we like to look at not only, again, the 23andMe genetic vulnerabilities here, but also we like to run the organic acids just to get an overall picture of how things are functioning and if the body is in an inflammatory state. So there's certain markers that allow us to look at that. So things that can cause a neurotransmitter balance. Number one, medications. So too many people are taking the SSRIs, the benzodiazepine, and over long term, it's going to just create an imbalance of these neurotransmitters. I'm not saying that you don't need them and they're not indicated, but I just feel they're probably overprescribed right now. We need to address proper gut flora, so our bacteria. Certain key supplements, B6, B12, magnesium, and iron deficiencies can cause it. Again, anemia, liver problems. Then some of the excitotoxins like MSG, the glutamates, and aspartame, food sensitivities, autoimmunity, hormone imbalances, leaky blood-brain barrier, amino acid and essential fatty acid deficiencies, and inflammation. So 60% of your brain is fat. So fat is actually really good for your brain. It needs it. So you need that proper 3 to omega-6 ratio to avoid inflammation. So it's good to have the avocados and the omega-3s, the good fatty acids. Avoid sunflower oil, cottonseed, soybean, canola oils. These just aren't really that good for you. And then toxins can lead to brain degeneration. So if you're exposed to herbicides and pesticides, heavy metals, there's so many more toxins in our environment now than there was years ago. And our water supply is just tainted with them. And some of these chemicals haven't even been researched by the FDA. So we don't even really know about their safety yet. We're kind of finding more and more out. The lotions we put on ourselves, and we're just all taking more prescriptions and the vaccines. So a lot of these build up the toxicity in the brain, and some of us just have an inability to detoxify as effectively as the next person. So what our body needs to handle these toxins are a proper functional immune system, a liver to help break these toxins down, and we do this through proper testing and functional medicine. So I live in an area where there's a lot of farmland, and a lot of my patients come in and they have issues due to the exposure to the herbicides and the pesticides. So we try to eat organic in our house. When I was aware or became aware that 2/3 of the toxins can be avoided just by eating organically grown foods, I felt that was an easy fix. Unfortunately, the organic foods cost a little bit more, so that becomes an issue for some people. And it's unfortunate. They should actually cost less. We should be paying more for the poison that we're getting. And it's super important to get proper brain activation. The single most important thing a brain needs is to be activated. It improves blood flow and circulation. So physical exercise, you hear it over and over, diet and lifestyle. So lifestyle part is you got to exercise, you got to take care of yourself and meditate. But what exercise really does, it increases the brain-derived neurotrophic factor, the BDNF. And what this does, this helps neurons branch together. So remember, I said it's not about how many you have, it's about how they connect. So the best exercise for the brain is high intensity. If you can do 7 minutes, that's fantastic. If you're just starting out, try to do 3 to 4. They have an app on the phone, the iPhone now, and some of these other phones. It's called the 7-minute workout. And it's a high intensity workout that really increases that BDNF that helps reconnect those neurons. It will also increase the nitric oxide levels, which helps to dilate vessels and dissolve plaque. And lastly, it impacts our insulin receptor sites so to make them less sensitive. So on our website, drmichaelveslack.com, we have a form, thanks to Datis Karazian, that is a brain health and nutrient assessment form. So this will just look at the things we just talked about: blood sugar, circulation, stress, essential fatty acids, the brain-gut axis, the brain immune axis, gluten digestion, neurotransmitters, serotonin, dopamine, acetylcholine, GABA, the catecholamines like norepinephrine and epinephrine. So if you want to fill this form out, go to our website, fill it out, and hopefully you'll be able to kind of see patterns there that you can start to identify it. If not, you can call the office, come in for a consult, or we do a lot of distance consult. We can kind of talk you through it and walk you through it. So in functional medicine and epigenetics, it's all about diet and lifestyle. You have to control glucose levels. So eat small meals, have protein every meal, eat when you wake up. You have to control stress. So make time for yourself, rearrange your schedule, and try to remove your stressors. Sleep for 8 hours. Meditation. Do things that are good for you. And then, of course, proper nutrition. You want to have good fats every day. Avocados, nuts, coconut oil. Your DHA EPA ratio for brain and neuronal support, you need a higher DHA ratio. You need to support methylation, so B vitamins, folate, not folic acid. Folic acid is not good for you. So if you are, it is synthetic, man-made. So if you are eating bread that says has folic acid in it enriched, don't buy it. So folate is what you really need. So methylation is a super important process in our body. It requires proper B vitamins, B12, folate. And then support the mitochondria, CoQ10, alpha-lipoic acid, L-carnitine. And there's others. But if you're having energy issues and brain fatigue, I always address and look very closely at how our body is converting food to energy. So the proteins, carbohydrates, and fats, are we breaking them down and taking our food and our metabolism and converting it to energy. Other nutrition recommendations is sometimes we need adrenal support. Like I said, we live in that fight or flight mode and we're always stressed out. So I like adaptogens. Ashwagandha. We carry a product in our genetic nutritional formula store called Adrenal Essentials. We need to always look at detoxification of the liver. So it's a process that goes on and on throughout the day. It's if you do a 1-day detox, 3-day detox, yeah, it might help you short term, but long term, it's not really helping. You have to work on this all the time. You have to have proper digestion, good hydrochloric acid, digestive enzymes. I've talked about the vagus nerve. That's our rest and digest nerve. So if you have constipation, trouble sleeping, always wound up, then maybe you need to improve vagal tone. A good exercise we like is something like belly breathing. And then, of course, support acetylcholine levels for our memory. So choline, we can get choline through eggs, egg yolk, and sunflower seeds. So choline is a really important component for, an acetylcholine for memory. Other conventional therapies that maybe you've already tried is counseling, exercise, music, hobbies, sleep. These are all great. These are the lifestyle changes we need to do. Meditate, Tai Chi. You can do Pilates, anything spiritual, yoga. We have to exercise, do that aerobic activity. So 180 minus our age. So if we are 50 years old, our target rate would be 180 minus 50. It would be 130 would be our target rate. Try to do it 5 to 6 times a week. Walking is super stimulating to the cerebellum, and this will help inhibit the fight or flight response. So if you decide to do nothing else, walk. It'll still help. And of course, there's practical lifestyle changes that most of them we're all aware of this. So we shouldn't smoke. We have to exercise. We have to maintain a normal gait. Don't get diabetes. Don't eat a lot of carbohydrates, sugars, no huge meals. Eat small meals to the day. Try to avoid living in a polluted city. Don't get periodontal disease. Floss your teeth, brush your teeth, take care of them. Doing coconut oil just to get the antibacterial in there, the lecithin, helps combat the infections in your mouth. You can supplement with vitamin D3, omega-3, turmeric, B vitamins, magnesium. And then it's important to stay socially and intellectually connected. You need to monitor and track your gait, your balance, olfaction, which is your sense of smell, and cognitive function. So sense of smell is one of the first things to go in Alzheimer's disease. So if you actually notice there's been a recent change, maybe that should stimulate some thought. In and by itself, it's not diagnostic, but if it just occurred and you're going, I just don't smell like I used to, then maybe that's a potential issue and you need to address it before it becomes too late. It's all about early detection. We do some brain-based therapies in our office. We go very specific to the particular lobe that is degenerating through our examination that we perform. So we'll do eye movements. We have something in our office called eye lights. We like the vibrations, a powerful stimulation for the nervous system, and gaze stabilization and balance exercises. We'll do different timing and rhythm exercises for the frontal lobe, the deep breathing like the belly breathing I talked about, and yoga, massage, acupuncture. There's a lot of these exercises to target different dysfunction of a lobe if we see it starting to happen. And then in our office, we utilize neurofeedback. It's painless, drugless, non-invasive, and most importantly, it has no side effects. So we do an evaluation, it's called QEEG, and we place these sensors on the scalp at certain points, and the sensors detect the brain waves and display them on our computer and gives us a nice little printout. So we're looking at like delta and theta, alpha and beta, and when we look at these waves, we can see if a patient has patterns of maybe high anxiety or ADHD or sleep issues. And by doing neurofeedback, we can help control some of these. So we will design a specific program for that patient based upon that QEEG. And the training is usually between, on average, 20 to 40 sessions. And currently, our success with anxiety is literally 100%. So we look at labs, we give exercises, we work on nutrition and neurofeedback. We have a 100% success rate with anxiety. And research shows that once you change the brain, the changes are permanent. Our brain will self-regulate. So once we stimulate and motivate in the right direction, it will change. So it will become and remodel itself, which is the neuroplasticity, laying down and reconnecting new neurons and new patterns. So Dr. Duffy, who is a pediatric neurologist at Harvard, basically talked about neurofeedback, and this is what he said, and I quote, "In my opinion, if any medication had demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used." So in review, what does a healthy brain need to thrive? Proper glucose, proper oxygen, neurotransmitters, activation, and an inflammation-free environment. If you don't have these basics, medications will not work long term. Need to address food and lifestyle. And protect the brain. Wear your seatbelts. Think about putting your kids in football. Is soccer having an impact? All the headers that they take? So what I do with some of my patients, I'll do a QEEG prior to the football season, and then 3 months after, do it again to see if there's any loss of brainwave activity in certain levels of the brain. You have to control your weight. Don't become diabetic. Make sure you exercise. Eat a clean diet, which is basically sugar and gluten-free. Try to eat organic. You need that deep sleep. I like a high-fat diet with butter and fish oil. Lower carb, calorie restricted. The ketogenic diet is fantastic for the brain. And there are certain supplements that I like. So vitamin D, huperzine, ginkgo. And then you need to stay socially and cognitively engaged. And I would say, if you're having any concerns, come to our office and get screened annually. I also think epigenetics plays a huge part. So the Human Genome Project taught us that 90% of our genes do not express themselves. But they do show susceptibility and vulnerability. And we know that diet and lifestyle factors affect how we express genes. We like to look at the methylation pathway and how the body detoxifies. So we like to do the interpretation testing from 23andMe, and it just gives us personalized recommendations for that individual that's unique and almost a blueprint to you. And I just am finding much greater success when I address the genetic component of some of these deeper issues. So what's next? If you're in the area, you can call and make an appointment. The number is 805-482-0723. As I've mentioned in prior webinars, I do provide consults through Skype. So I see a lot of distance patients throughout the country and actually internationally. So if any of this interests you, you want to pursue the genetic testing further, you want to talk about some functional medicine concerns that you might have, please call the office or email me at dr.